Hi viewers, welcome back to Sahara TV. My name is Adiola Fayon. In this segment, we are discussing the illness of the Nigerian First Lady, Mrs. Patience Jonathan. There has been a lot of speculations about what's going on. Nobody knows exactly what is going on as far as the First Lady is concerned. There's been a lot of speculation starting from food poisoning, appendicitis, and so on and so forth. So we have a Nigerian doctor based here in the US to help us out today to discuss what exactly could be going on based on his experience as a medical doctor. He's Dr. Benjami Nwosu, and he's the Associate Professor of Pediatrics at the University of Massachusetts Medical School here in the US. Dr. Nwosu, welcome to Sahara TV.
Thank you so much.
So, Dr. Nwosu, I have a long list, like your bio is like so long, and to save time, can you just tell our viewers a little bit about yourself so they can know why we decided to talk with you?
Sure. So my name is Benjamin Nwosu. I went to University of Nigeria Medical School, and after that I did my residency training in pediatrics at the Howard University Hospital in Washington, D.C. And thereafter, I moved to the National Institute of Health in Bethesda, Maryland, where I did my fellowship in research in endocrinology. And then I joined the University of Massachusetts Medical School after that, and that's where I teach, see patients, and do research.
I see. So, Dr. Nwosu, there has been a lot of speculations about what exactly could be going on with the First Lady. Let me start out first of all by asking that, how bad can food poisoning be that you have to be taken all the way to Germany for treatment?
Sure. So let's step back a little bit and define what food poisoning is. So this is any illness that is caused by the consumption of food or water that is contaminated with bacteria or toxins produced by bacteria, in addition to other microbes like parasites, viruses, or even chemicals. Okay, the symptoms could be very mild, in which case it runs a self-limiting course and resolves by itself. In other cases, it could be fulminant, so it might result in serious threats to life. So it depends on the nature of the presentation.
So do you think that her sickness could actually be caused by food poisoning?
Right. In some types of food poisoning, you may have what is called the inflammatory diarrhea. So this is a situation where the organism or its products would actually invade the mucosal lining of the intestine and get into the bloodstream or into the lymphatic system and spread across the whole body. So this could result in damage to major organs like the kidneys, the liver, and could also affect the central nervous system.
Dr. Nwosu, can food poisoning seize your voice? Because some of the reports that came in was that the First Lady lost her voice for 4 days.
It could not be as a direct effect of the food poisoning. However, when they say she lost her voice, they have not provided the entire history. In other words, they're not telling us what is happening to the rest of her organ systems. If she lost her voice because she went into, severe dehydration, resulting in shock and maybe coma, and so was not able to communicate with anyone, right? So that is possible in severe cases of food poisoning. However, if the presentation is just an isolated loss of voice, which is in medical terminology is called aphonia, then that might be due to something else. Okay.
So because we're not really sure exactly what could be going on, but let's say it's food poisoning. Aren't there doctors in Nigeria that can treat this? Do you think that this can be treated in Nigeria, or it had to be taken to Germany?
It could be treated in Nigeria. However, the complications of severe food poisoning could result in, for example, liver failure or kidney failure. And at that point, I'm not sure that there is enough facility in the hospitals in Nigeria to deal with this severe presentation. However, I'm not saying they cannot do it, but I'm beginning to feel that when things begin to deteriorate, the family may begin to say, let's lift her out of the country.
Okay, so some other reports are saying that it's appendicitis. Isn't this something that can be easily treated in Nigeria if it were to be appendicitis?
Oh yeah, people treat appendicitis every day in Nigeria, so I don't think that should be a reason to leave the country for, advanced medical consultation.
So you think that appendicitis could have been treated in Nigeria? They didn't have to take her all the way to Germany if it were to be appendicitis?
Yeah, appendicitis is a routine surgery in Nigeria, so people do it every day, every time in Nigeria. So there's no reason to fly her out of the country because of that.
Okay. So, Dr. Nwosu, the first lady has been in the hospital for quite some days now. So let's say it was food poisoning. How long does it take for someone to recuperate from food poisoning?
So the mild cases will last for hours, and that's over, okay? But the severe cases could linger, because in severe cases you begin to have complications due to either organ failure or severe shock and from dehydration, because you may have associated severe diarrheal illness. And so that could take a while. Now, if she has developed complications, then they are no longer treating just the food poisoning at this point. They are going to be managing the organ failure if that is the case, and thinking of how to make sure that the outcome is favorable for her.
I see. Dr. Nwosu, as a medical doctor, why do you think that someone would try to hide whatever is going on, especially someone of a public figure? Why do you think they would try to hide the true nature of her sickness?
I think that is very common in developing countries, where there is always the fear that if there's any revelation of weakness in the chain, that it could provide an avenue for people to either take advantage of those in power, as opposed to here, where people would easily disclose what is going on with them. And also here you have a very strong press corps that would always want to see the health information of people who are running for very high offices. However, this is also her personal information, because she's not an elected leader, so she has the right to not to disclose her health information.
Okay, Dr. Nwosu, there has been other speculations also that maybe it's possible that the First Lady had a plastic surgery somewhere, maybe Dubai or that area, because she was reportedly, the sickness reportedly started from Dubai. Can this be, is it possible that this can result from infections? Is that a possibility?
You mean that she had surgery and had complications from the surgery?
Yes, maybe like lipo, a former First Lady had tummy tuck surgery.
Okay.
And yeah, so there have been speculations. Nobody knows exactly what is true as of now. We're not saying that this is what happened, but if that were to be the case, is it possible that the sickness could have evolved from having infections from plastic surgery? That
is true, and that is possible that she could have had post-operative postoperative complications. It could be infection, it could be bleeding, and again, it will present like a case of food poisoning, because if she is having an internal bleeding, right, she's going to present in a similar fashion as someone who is having severe diarrhea, because the endpoint is shock-like state, prostration, organ failure, and so on and so forth. So that's possible, but I'm not saying that's what she has, because I don't know the medical detail.
So, Dr. Nwosu, you said that you had an experience working in Nigeria before, even though it's for a short period. Can you tell me some of the differences that you noticed between the situation of our medical situation back home in Nigeria and having worked here in the U.S.? What are some of the things that we are yet to put in place, that we really need to put in place, so that people don't have to travel overseas for medical treatment?
Thank you so much. This is one of the things that I always talk about wherever I go. So the major difference I see is that medical practice here is centered around research and evidence-based practice. In other words, these people are always trying to create better outcomes for their patients. They do their own research, and so they understand the diseases that are prevalent here better and how to tackle those diseases. Now, back home, there is little or no funding for research. So people rely on textbooks that are written here, discussing the demographics and epidemiologies of diseases obtained here. But there's no careful systematic study of the diseases that are prevalent in Nigeria. Therefore, the treatment is not well targeted to the illnesses. So that's one. Two, the infrastructure is basically not there. I was recently in Nigeria in March of this year, and I went to some of the teaching hospitals, and the way the patients are admitted and kept in the wards is like what's happening. You can never see that here any longer. So, and then the protocol involved in patient care is not updated constantly to meet with the challenges of modern times. Therefore, there's a lot of problem there in terms of patient care. And also another point is the behavior of the physicians. So here in the United States, we practice what's called the patient-centered medical care. So the patient is at the top of the pyramid. But in Nigeria, the physician is at the top of the pyramid. I'm not saying it's just Nigeria. In all developing nations, actually, and in some so-called advanced nations, you still have physician at the top of the pyramid, so that the physician can say or do almost whatever he likes. And the patient cannot sue the physician or take him to court, right? So that's a problem. We have to move the center of gravity to the patient and not to the physician, so that physicians will be more responsible and responsive to the needs of the patients.
I see. Well, Dr. Nwosu, is there anything else you would like to say about this before we finish?
The only thing I will add is that I know that this is a hot topic because it involves the First Lady, and we've had a case of a First Lady who died while going through a cosmetic surgery in Europe. But I think we should give her the benefit of the doubt, and hopefully we may learn the true nature of her illness. However, she is a private citizen. She's not an elected citizen, so elected official. So she has the right, though, to not to disclose her medical information.
Yeah. Speaking about having a first lady, a former first lady that passed away, that was Stella Obasanjo, who died in Spain. Also, Miriam Babangida also died in Los Angeles.
That is true.
Yeah, and the former president Yaradua died in Saudi Arabia. So it's such a shame that we've lost a lot of, we've lost quite a few public figures that have died in a foreign hospital. So the hope is that we would have our own hospitals in Nigeria, in which our officials wouldn't have to be traveling overseas and for medical facilities. Yeah.
The truth is that the hospitals are there. The problem is that the hospitals are not well funded. They are not well run. And the physicians who are in those hospitals also have their own private practices. So the hospital now serves as a conduit for those physicians who are supposed to be, you know, professors in those medical schools, to basically route patients to their clinics. So that is wrong, and that ought to be corrected. I think people should emphasize, people who want to practice medicine should concentrate on the aspect of learning and advancing the profession rather than using it as a conduit to transfer patients to their private practices.
I see. Thank you very much, Dr. Nwosu. We really appreciate your time with us today.
Thank you so much. I appreciate this.
Yeah. That has been Dr. Benjami Nwosu talking about the illness of, discussing the illness of the Nigerian First Lady. Stay tuned, we have other segments coming up, including the round table. Once again, I'm Adela Fayon. We'll be right back.